All righty. Well, this is Monday, the 9th of August, 5:30. This is where we do our weekly Monday evening talk to the doctor. And we are here at Tustin Longevity Center. We are in Southern California, Tustin. We are a group of physicians. There's 5 of us healthcare providers here. We do integrative functional medicine, standard medicine, gynecological, natural hormone, anti-aging, lifestyle modification. And we really have a great time doing it. And we see a lot of blessings in our patients. And it's just a wonderful time to be a doctor doing this natural medicine. So with that, we have created this Talk to the Doctor channel. So anyone, not only our patients, can ask general questions. This is not meant to be personal advice for our individual patients. They can call the office and have a formal telephone question that we will pull up their chart and look at their particulars. But this is for general questions, general conversation, walk in their lifestyles at home, improving their immune system, their whole health, and their bodies to resist disease and aging. So with that, we'll start. Our first question is from Lynn. Hi, Dr. E. She goes, it's been 3 months and I'm now reintroducing my 16 food sensitivities from my Immunolabs test. At what point should I introduce pre and probiotics, and what products do you recommend? Well, when you have done immunofood, that's the slow reaction to antibodies formed to food. These aren't the immediate IgE. These are the IgG slow antibodies made to food. And our tube from our mouth all the way to our anus is aging with us, and it can wrinkle and crack, and lectins and irritations can create holes in the wall, and then food can leak through. So if you habitually drink a tomato juice, let's say, or you habitually drink, thank you, wonderful, eat a particular food, let's say you have almonds every day, that's pretty common. The likelihood of those almonds going down every day and the likelihood of that tomato juice going down every day is going to increase the likelihood that it'll leak through one of these cracks or breaks in the esophagus. That will then be picked up as a foreign protein body, lectin in your body, and you'll start making antibodies to it. It doesn't mean you are allergic in the sense of having hives or wheezing, but it will create a waste of your immune system lining your gut here, which is about 70–80% of your immune system is the gut-associated lymphoid tissue to protect you. So we do this test, and then we'll find a list. I typically see people have about 20 of them. There is no one I've ever seen perfect. The company itself has been in practice for 47 years, so they do an excellent job. And even the owners have told me that maybe 9 is typical, because no one has a perfect tube. So if you're 9 or less, you're certainly doing very well. When we get the results, then we ask you to avoid the foods that are listed in red that you did react to. After 3 months, then we say you can start eating them again, but we would never have you eat them every day. So we would say, try one food and wait 3 or 4 days and see if you have a headache or rash or bloating, or your energy is lost, or you get congested, or you develop a headache, or your joints ache. If that happens 3 or 4 days after eating that food, then you know that you're permanently kind of sensitive to that food. And I wouldn't use it much at all, if ever. However, most people from these IgG slow antibodies can reintroduce them and have them once every 4 or 5 days, maybe once a week. So reintroduce these in a rate where you're trying one food back and then wait 4 or so days. And if you have no problems, then that's fine. You can have it once a week. Now, probiotics and prebiotics, I would always use, whether or not you've done the test. If you thought, Lynn, that you weren't supposed to be on probiotics or prebiotics, that was a misunderstanding. You can always be on probiotics and prebiotics. We have a probiotic called Orthobiotic, which is a broad spectrum probiotic. We have Orthospore IG, which is another very good one. And we have O'Hara's Essential Probiotics, again, very, very good. And these all have a variety of different types of strains that are known to be beneficial for the gut flora, your microbiome. We have a very high potent one we use in acute situations. Often if you have to go on antibiotics or you have a diarrhea or you come as a new patient with chronic inflammatory bowel disease or colitis of some sort. Probiotic 225 is a powder that we often mix with a fat called NT powder that helps the bilipid lining. You see in the picture here of these cell membranes. It's a double layer of phospholipids. So we'll put that in water with probiotic. And very often I will use SBI Protect powder, which is a protein because the cell membrane is fat and protein. And the three things together taken for about 2 weeks usually calms down almost every case I've ever had. Our protein bars have the probiotic and the prebiotic in it as well. If you eat artichokes, that has inulin in it, bok choy, that has it in. So if you look up on your computer prebiotics, you'll see foods that have this non-digestible for a human starchy complex carbs that are used by the good bacteria to eat off of and populate your healthy microbiome. So that's what I would say. Use the probiotics now, any one of those, and are the ones we've studied and I feel good to endorse. And foods you can look up like artichoke, bok choy, that will have the prebiotics in it for you as well. Then Doris asks, hello, Dr. Ellithorpe. Please discuss magnesium benefits. Should magnesium be taken along with vitamin D? I understand magnesium may assist with the absorption of vitamin D. Thank you. Well, magnesium is a mineral, and minerals are often cheaply made over the counter as metal oxides, meaning they're combined in a fashion that is not an amino acid. So we use Albion in our production. That is an amino acid that is linked biochemically to the nutrient mineral magnesium. So we'll have magnesium glycinate, magnesium citrate, magnesium sulfate, these kind of things, instead of magnesium oxide. The reason is the amino acid chelates combination with an amino acid is far better absorbed in the human body, more beneficial. Now, vitamin D is a fat-soluble vitamin, and fat-soluble vitamins are best absorbed with a fatty meal because it's fat-soluble. So I really don't know that there's any science saying magnesium helps vitamin D absorption, so I don't think you need to worry about that. I use my nutrients in a very simple fashion. I use digestive enzymes to help me digest my food at my age approaching 70. I don't digest as well as I did when I was a little kid or young woman. Now that I'm much older, I do need help with digestion. Then there are enzymes that have to be taken on an empty stomach to be absorbed from my gastrointestinal system right into my system to help with the inflammation in my joints. And so these systemic enzymes need to be taken on an empty stomach. So I have split my vitamin plan into a simple thing: digestive enzyme when I'm eating food, and I take all my other vitamins when it's convenient to me. So I take my vitamin D in the morning, even though it's a fat-soluble vitamin. I take it with an empty stomach in the morning. Nevertheless, I can check my vitamin D levels, and they're very good. So that's how I do it. And I split it into 2 times simply because I take so many. That way I don't have a huge bowl. I probably have almost a bowl full every day that I take. So why is magnesium good? Well, if you ask in research for nutrient research on human performance and assays, you'll find that magnesium is probably the most deficient nutrient mineral in the American diet. And with all the processing, with the industrialization of food, agriculture, big machines, big insecticide, pesticide treatment, glyphosating, and using the land over and over, we are raping the land with big industrialized farming instead of the multiple hundreds and hundreds of family farms that we used to have 50 years ago. So that the farm land is being abused, and the minerals are taken up out of the land and brought into the plant. And if you are not replenishing that, then your mineral absorption and vitamins that you're getting are going to be inferior. I have seen assays of comparing the nutrient density of a carrot or a tomato or an apple compared to, I think when they were popularly done was in the 1960s, and those that have been done of late, I would say it's close to 50% reduction in the nutrient density of our foods. So yes, you can make an argument that we do need to use some supplementation, especially with the current state of the sad American diet. Magnesium has countless cofactor biochemical activities throughout our body, not to mention the cardiac rhythmicity, smooth muscle relaxation, the neurological impact for our nerve functions, calming our brain. But again, a lot of this also depends on how much water you drink every day. So many times what we are thinking are cramping and aches and pains is because we really just don't drink enough water. And so I would probably take a good multivitamin that has 150 to 250 micrograms, milligrams of magnesium in it, of a amino acid chelate as a base. Animal foods are very high in minerals as a general rule, as well as wild caught fish and wild eggs, chicken, and stuff like that. If you're going to be a vegetarian, you're going to have a higher risk. If you're buying all your food from small farmers, organic farmers, you're safer off, but I still think I would supplement with a good multi-mineral amino chelate. Hopefully that helps you. Let's see. And let's see, the next one, Sean. Sean, hi, Dr. E. Can you discuss if copper should be taken when taking zinc and what the typical ratio is? I'm currently taking 50 milligrams of zinc daily. Thank you so much for your dedication and your patience. Yes, 50 milligrams of zinc is a very hefty dose on a daily routine basis. I think most multivitamins have 6 or so milligrams in it, assuming the person is going to take it every day, along with your diet in a reasonable amount of animal products, composing maybe 30 grams of protein from animal products a day. If you're a vegetarian, you would want to buy from organic sources. Copper and zinc have a bit of an antagonistic relationship, and you can make an imbalance with it. The need for copper is essential and the need for zinc is essential. Most would say a 1-to-1 ratio of zinc to copper. I think that's a safe way. Some say take a little less copper to zinc, maybe two zinc for every 1 copper. I have never seen this, and I'm doing mineral assays on my patients all the time. So I haven't seen this, Sean, turn out to be a problem with producing copper deficiencies. When they started out with this viral protocol, and I saw some of the recommendations recommending as much as 250 milligrams of zinc daily for many days, I thought that was excessive and would have depressed the copper. So I think 50 milligrams of zinc is safe on a routine basis. I ultimately don't think you need that much. And again, it depends on the kind of zinc it is. If it's a zinc oxide, then maybe the higher milligram is needed. If it's a zinc amino acid chelate, then you wouldn't need as many milligrams because the absorption will be better. We do the amino acid chelates. We have TLC multimin, and we have zinc carnosine, which are all well absorbed, and then we can retest mineral levels from time to time. So hopefully that helps you. The ratio 1-to-1, if you're going to shift it any, you're going to have 2 zinc to 1 copper, but don't go beyond that. The dosing for copper usually is 1 milligram, maybe 2 milligrams a day. But I need you to understand that you can get your minerals evaluated at a functional doctor's office. And that's probably the best guidance, and have a routine and let your doctor know what you're doing so we can take a look at how you're doing maybe once a year or every other year. Hopefully that helps, Sean. Jennifer, hi, Dr. Ellithorpe. Hi, thank you so much for being here for us. Okay, thank you. I love being here. This is, I love my patients, my family, and my God, so it's my joy. What do you recommend for a stroke recovery? Stroke. Well, a general approach is if the person survives the stroke, how injured are they? No matter if they have very minimal injury or very large injury, we believe that you need to help the blood flow with a very low carb diet, because the more sticky your blood, the more likely you will be prone to inflammation and blood clotting. Number 2, you need plenty of water to keep that nice fluidity of the blood vessels and the capillaries. Remember, there's actually no blood pressure between the arterial to the venous. So this no man's zone is really an electromagnetic mystery that the BEMER, I think you've asked before, Jennifer, about the BEMER mat. That is a electronic signal wavelength that is in sync with the actual pulse of the electrochemistry of the endothelial lining. So water, low carb, then we would take systemic enzymes on an empty stomach. All these would help to reduce inflammation. If you could find out what the food allergies are or have the person become a carnivore, you reduce the inflammation that food lectins. Remember, plants have protein repellents on the outside of them. And these are called lectins, which are phytates and oxalates and tannins and so forth. So a lectin can create of itself, just because of the food and your blood type, a inflammatory pro-clotting situation, because anytime there's inflammation, you're going to have platelet aggregation and certain cytokines released, and that will present the potential for blood clotting. So anything we can do to disinflame, enzymes will help that, water will help it, a low carb will do that, and avoiding a lot of food inflammatory reactions is helped if you go on a organic carnivore type diet. It's very satiating. It's nutrient dense. And the other thing is, of course, I would, be under the care of the cardiologists or internal medicine specialists. And usually a person like that will be on blood thinners anyway. But systemic enzymes will also benefit it with the blood thinners to help remove the broken down debris and damaged cells that didn't receive blood supply and oxygen. So they work to help clean out the poor cells that are damaged beyond repair. Another thing is, you would, of course, be under the care of the cardiologist or internal medicine doctor or neurologist. They should have you in some kind of the person in physical therapy because the sooner you can start doing muscle memory and neurological memory with physical therapy is always advantageous. So motion movement with a physical therapist is very beneficial. Then taking a powerful antioxidant, we would use Juice Plus because of the whole volume of research on protecting from DNA damage, anti-inflammatory, immune enhancing, homocysteine, elevating cardiovascular benefits has been published in the Journal of Cardiology. I would also be on a good multi-mineral because muscle relaxation, if you've had a stroke, you may be fixed in a motion and your muscles can't relax, so you'll need to have adequate magnesium and minerals for that reason as well. Outside of those ideas, then I would encourage the person to get EDTA chelation therapy, and I would usually do it enhanced with vitamin C because that helps microcirculation. Because if you have a little damage area on any part of the brain from the stroke or on the heart or anywhere in your body for that matter, the area that was injured, be it post-surgical from an elective surgery or the stroke in the brain or the dead heart tissue from the heart attack, you're going to have a zone of area that is marginal. The marginal zone was not completely denied oxygen, but it hadn't had good oxygen, so it's injured. So the sooner you can get microcirculation to that region, the better off that area will be. And you can reduce the size of the ultimate scarring or permanent injury site. So hopefully that helps, Jennifer, with the general approach we would have to helping someone who had a stroke. Amila says, hi, Dr. E. Would men also benefit from supplementing with iodine? Would you recommend iodine loading tests before supplementing for men? I would say, yes, they will definitely benefit from iodine, and children will, and pregnant lactating mothers will. I say that because you can go get a book by David Brownstein, Brownstein. David is up in Michigan. He's a family practice physician, and he worked very hard with his father with prostate cancer or prostate problems. I'm not sure if he had cancer. And in his research over the many years, decades worth, he found that nearly 96, 97% of the United States population is iodine deficient. So iodine is needed by everyone. It's one of our essential nutrients. But it's not in our diet so much. When we, in the 1930s, 40s, 50s, 60s, we all had iodinated bread, iodinated salts, and now it's all brominated. And bromine is a halogen in the halogen family, and iodine is one of them. It's the weakest of them, but it's essential for us. But bromine will knock it off. And so you can become iodine deficient. We believe iodine would be beneficial in preventing prostate enlargement, breasts, fibrocystic breasts, fibroids, all manner of glandular sensitive tissues in particular, and enhanced mental IQ. Because, underperfunctioning, that's a new word, underfunctioning brains from low thyroid is associated with mental retardation. And they test newborn babies for adequate thyroid function so they can avoid this with supplementation. That's why taking 12.5 milligrams is safe for anyone. We say that because in Japan, the women in Japan, where there's a statistically much lower breast cancer prevalence, off the top of my head, I think a lower prostate cancer prevalence, is because the Japanese incorporate so much iodine-rich seafood, seaweed into their diets every day. And when you do an assay on the Japanese diet, traditionally they eat every day 12.5 milligrams in their seaweed and seafoods. So if you take a tablet of iodine of 12.5 milligrams, you are going to just get the bare minimum that you need. When you read Dr. Brownstein's book, you'll see him recommend something like 50 milligrams to 100 milligrams. No, I think it's 12.5 to 50 milligrams. I stand corrected, 12.5 to 50 milligrams. And the loading dose would be 50 milligrams a day for a period of time, and then you would retest. I've never recommended 50 milligrams. I've always used 12.5 to 25 milligrams for all my family and my sons when they were much younger, but now they take care of themselves. My husband, I encourage him to use 12.5 to 25 milligrams. This is well established. We have the epidemiological, we have the dietary associations, and then we have the better mental IQ functions of the Japanese as well because of this. So I think we'll have better IQ in our children if we restore the iodine that they need. Hopefully, Amela, that will help you. Now, if you have a child, I would certainly say that 6 milligrams of iodine a day would be very fine. Again, the dietary behaviors of the Japanese with their children is usually around 6 milligrams a day. So you could take one of those 12.5 milligram tablets and break it in half, give it to your child. Okay, let's see. Next one. Dolphin. Okay, how do we know if we have kidney, liver, gallstones, and what do we do about them? What causes them? Well, when we do a general chemistry panel on you, I can look at liver enzymes, I can look at your kidney function, and I can see if they look normal, then I would assume the organ is functioning normally. Some people have gallstones without even knowing it. A simple ultrasound can show that. An ultrasound is a sound wave over your tummy. It's far safer than CT scans or x-rays, which we do if it's absolutely necessary. But unless you're having abdominal pain in your stomach, usually associated with eating a richer fat diet, then I would, if you're not having that problem when you eat steak or chicken or pork or bacon or eggs, then I would say that you're probably doing well. I still think that you should find out your blood type, because A-type blood people don't make enough digestive enzymes, and when they eat fat and protein-rich food, which we're made of, we're all composed of it, then they will have some discomfort in their stomach, generalized, non-specifically vague abdominal discomfort, just because they're not digesting well. But we don't really know what causes a kidney stone or a gallstone. There's conjectures, ideas, wives' tales. I would say largely this is because we don't drink enough water. If you don't drink enough water on a daily commitment, then you are going to have more sludge, slow flowing waste material, whether it's your urine and urinary draining systems, or it's your bile as well. Water, you're made of about 70 to 80% composition of water. That should be everyone's taught from their parents to their school hygiene, high school athletics. Water is what we need. So if your waste materials, your bile, your urinary draining systems are more sluggish, that will create more opportunity for a tiny cell membrane to get irritated, to attract inflammatory proteins that would maybe create a little crust over some injured area that may become a nidus or a point of irritation that can evolve into a stone, whether it's a gallstone or a kidney stone. I honestly think it's inactivity, lack of exercise, not drinking enough water, and the chronic inflammatory lifestyle we eat with our lousy foods, our trans fatty acids, hydrogenated cheap foods, all these fried chicken, fried French fries are fried in these seed oils that are absolutely linked with research suggesting a increased proclivity for cell damage, cancers, and inflammation. You shouldn't be going to fast food places. You should be taking the time to bring a lunch with you, cook your foods, get a slow cooker or a rice cooker or whatever you do to try and have your foods at home, and eat out at a fast food restaurant very, very rarely. That should be the treat, the fun thing, the little dangerous fun thing you do once in a while. And so hopefully that helps you with the question, Dolphin, about what do we do about them. Drink water, okay? Take a walk every day. Don't eat late. Then Robert asks, I learned a tremendous amount by using a freestyle Libra continuous glucose monitor. Do you think it could replace a glucose tolerance test? Definitely, yes. I think it teaches you what foods raise blood sugar. Absolutely. Now, if we had a healthy and a medical system and CDC and FDA and all that really cared about us and not rather work for just the corporations and the pharmaceuticals, then they'd be talking about immune and well-being of our lifestyles all the time. But you never hear about it because it doesn't make a dollar. So if we had healthy foods and if we had less sedentary lifestyles, sitting, watching YouTubes and stuff, then we would be burning calories. We would be more satiated with a healthy fat, healthy protein proportion to our complex carbs. We drink more water, and we would more naturally stay in a euglycemic, natural, healthy flow, and the average tolerances would fall. And we would have a healthy blood sugar range from 55 to, say, 85. A lot of labs are 75 to 105. This is really pre-diabetic training on training wheels. Now, if you practice intermittent fasting, so if you have a time-restricted eating, let's say only 6 hours in a day that you allow yourself to eat, whether it's 7 a.m. to 1 p.m. or 11 to 5 or noon to 6, but I wouldn't eat past 6 o'clock because it's very hard on your body to digest food. The more the electromagnetic energy of the sun and the darkness ensues, there's just a magnificent connection to the planet and the universe just by the time of the day and the sun being up. So if we take care of our health, only eat in a 6-hour window, some can cut that to 4 hours. If you already are overweight or have a little obesity, if you're aging, if you have any of the comorbidities like diabetes, type 2, if you have hypothyroid, if you have arthritis, if you have, reflux disease, if you have high blood pressure, heart disease, any of these will be helped if you learn to eat in a time restricted window of 4 to 6 hours a day. And once in a while, try and learn to do a 1 or 2 day fast just on water to help yourself have that metabolic flexibility to burn a little carbs and then to go back to burning fats as your sustaining energy source. If you use a continuous glucose monitor Yes, you can see immediately if you keep a catalog and then you compare that with the time sequence on your continuous monitor, how that meal spiked up your blood sugar, and then you can just assume your insulin was spiking with it. Then you can start patterning yourself in a diet that would create less of a spike. And that goes along with that concept of glycemic index. So you want to eat foods that have a low glycemic index so that when you eat them, the ability of them to immediately make your blood sugar peak and rise is diminished. And that would be in complex carbohydrates. Of course, all animal products basically will not raise your blood sugar. Fats will not raise your blood sugar. That's why that's such a healthy lifestyle to become a carnivore, especially if you have to heal quickly from a serious disease disorder and lose some weight or get your blood sugar under control and your insulin under control. Because you'll see almost all roads lead back to insulin creating growth promoting fat and thickening of your blood vessels and diabetes, tumors, because of the higher cheap availability of carbohydrates in our diet. Thank you, Robert, for bringing that up. I may not say the name right. Marmajo. What are your thoughts about the use of ivermectin for the treatment and or prevention of COVID-19 after exposure or with actual diseases? Well, I am in favor of it. I have seen somewhere around 56 studies worldwide, of which at least at the moment, well, as of December, and what was his name? Andy Hill. He was a research scientist that did a meta-analysis of all the tests done regarding ivermectin and COVID-19 throughout the world. Out of it, he picked 11 studies that satisfied what he thought would make the World Health Organization happy and pleased. And he reviewed them. I think the study had enough participants out of the 11 that conformed to a randomized controlled trial and had around 1,500 patients total. If you add in the other 20 some more, because I think there was like 55 in total, and there's probably more by now. The data was very convincing that it was efficacious for prevention, to prevent. We know there were some studies in South American countries for their healthcare workers that was well designed, and they gave ivermectin to some of the healthcare providers, and others did not get it. They got a placebo. And of the ones that got the ivermectin, none of them over a many month time last year got COVID, and maybe somewhere near 50% of the other healthcare workers did come down with COVID. And then they looked at case studies, hospitalizations, ICU admissions, and then those that were severely ill needing respirator. And always it showed those that had the ivermectin had an increased survivability, less days of hospitalization, and a quicker reduction of viral shedding. So I absolutely am in favor of ivermectin for prevention and for early treatment and even late treatment. You know, Dr. Fauci is talking about coming out with a oral medication that basically mimics everything that ivermectin does. He wants it developed to not have any significant drug interactions with other medicines you might be on, and ivermectin fits that bill. He wants it developed so that it will reduce the shedding time of viral illnesses, and ivermectin does that. He wants it to reduce hospitalizations, ivermectin does that, and he wants to reduce mortality, and ivermectin does that. So I think, he's probably going to try and find some kind of medication that it mimics ivermectin, and will finally have a good preventative that they'll allow with open arms. The NIH changed their philosophy from they were against ivermectin for some reason. And then after all this material was presented by Andy Hill and many other physicians to the NIH, they changed it. And instead of being against ivermectin, they said they were neutral. So very good. Merck made ivermectin, and it's been, I think, in use since around 1990. And there have been almost 4 billion doses given to pregnant women, children, nursing mothers throughout largely Africa to prevent the infestation of worms and those kind of illnesses. And they're really in the past 30 years plus almost 40 years, there have been only maybe 16 deaths that they think might be related to ivermectin. And I think the details in the papers regarding those few deaths are when you have such a bad worm infestation, and ivermectin is so powerful when there's such a large die-off of the worms, they really felt that the deaths were secondary to the volume of burden of the infestation. So that compared to any other drug, it got the Nobel Prize in 2015 for one of the most valued world medications on the World Health Organization list of medicines in the world. So I think it's a very safe and logical thing to do preventatively, early treatment, and after if you feel you are diagnosed with COVID, to use it to try and prevent hospitalization. And even if you get hospitalization, to use it there and in more serious disease as well. Okay, hopefully that answers you. The next question, Azar says, hi, Dr. Ellithorpe, would you please talk about COVID vaccine and Delta variant? Well, I think that we have these viral illnesses, and there's two camps. One camp is the terrain is more important, and your terrain is your general health. Your terrain is you. When Louis Pasteur was coming up with his the infectious agent theory of disease, later in his life, I think even in his diary, he had admitted with his colleagues back then that it was the terrain indeed that made all the difference, and it wasn't the infectious agent. So I've enjoyed and been blessed, and I thank the Lord for all my patients have been doing very well in that, whether they were in their 90s, I have patients in their late 90s, many in their 80s, many in their 70s, including my husband and almost myself, many in their 60s and 50s. So we know that we have always had them over the many decades I've worked here on a low carb diet so that they wouldn't be obese or diabetic, that they would drink their water. I had them all taking systemic enzymes as you get older for joint pains and inflammation, and also digestive enzymes to help with the sort of say purification of what you're eating to help digest it better. By the way, hydrochloric acid and digestive enzymes help sterilize your food when you're eating it. So I've had my patients on that. I had all my patients on vitamin D already at a good, reasonable dose on the upper limits of normal. I had always my patients taking a multivitamin that had zinc in it, which is an ionophore that helps inhibit viral replication. I've always had my patients taking Juice Plus, which is well published in the immune response, even in smokers. So Juice Plus is a great immune boosting supplementation to take. And many times I had them on iodine, and there were individual studies about iodine being valuable in preventative studies. So I've been taking all these things, including my iodine. I had the Argentine Silver nasal spray. I'll often use that at night to rinse my nose out to keep any inhaled virons, bacteria, fungi, particles under control because nanoparticulate silver kills it. So none of my patients in my practice with us 5 doctors I've heard, nor have I of my individual patients, no one was hospitalized, no one died. And I have a large older group, including myself and my husband. So when you say, should we be concerned? I would say be concerned about taking care of your terrain. Drink your water. If you're a little overweight, learn to do some intermittent fasting. Walk every day. Don't eat late. Get away from processed, high carb junk food. Take those things that I just listed. Find a good source. Or if you're a patient here, recommit to taking them faithfully. The other thing is, I just was listening to a study put out by the CDC on annotating the whole year, what were the comorbidities, the age group, and everything of those that succumbed to the virus. And it was the well over the 80s. Although I had just this week treated a gentleman for COVID who's 86, doing quite well. And he's my patient. He's been my patient for many, many, many years, and he's handling it without a bat of an eye. But my point was, they said that obesity, and of course, this gentleman at 86 is not obese at all. Obesity was the #1 comorbidity. And if you had one comorbidity, you had a low percentage of mortality or possible death. If you had 2 or more comorbidities, it jumped to 30%. If you had 5 or more comorbidities, I think it was something like 39% additionally. So you can see if you had diabetes, obesity. Interestingly enough, they associated one of the comorbidities was anxiety. I found that very intriguing reviewing the science. So this is put out by the CDC, so you can scroll through that on anxiety and morbidity for COVID-19 mortality. And that was in one of the top 2 comorbidities. So there's something about uncontrolled fear that maybe releases cortisol, that is immunosuppressive, like being on chronic steroids is immunosuppressive. So you have to understand that has emerged in the data that fear is not good. The only thing I fear is God. I look forward to the day when I can go to heaven and rest finally. In the meantime, I love his creation. I love his patience towards me and my patients that he made. And so I really am not afraid to pass on because I have faith and I believe in an afterlife. So I am very much at peace with this, and I'm very much at peace with the lifestyle, the things that I can do. For those patients who do not have a faith, we do see that people who don't go to church, who are not married, these people, there's a profile, I can't recall it right off the top of my head on a meeting like this, but their life expectancy is shorter than those that have this kind of a religious attending weekly marital social group and support. So to say, a environment to live in and to die in. And so I'm, as I approach 70, of course, I think about my end as well. But I have happy thoughts toward that because to be absent from the body is to be present with the Lord. So I really don't give it much thought. I keep myself busy thinking about other people and their needs. And I would just encourage you to find faith, to find your religious groundings, those that you could share with, because I was so surprised to see that anxiety was second on the list of comorbidities that was associated with a poorer outcome. So let's see, that was probably too much information. You wanted me to talk about COVID vaccine and Delta variant. Okay, so the vaccines are designed and seem to have reduced the number of hospitalizations and seriousness of the illness. This is the way the data is coming out to us. I don't think there's enough information about the vaccine itself, the methods, and that would make me comfortable enough as a physician to feel that I've given informed consent to my patients. So remember, you have to give informed consent. The Nuremberg trial codes, the ethical codes, the Geneva codes when I was on active duty about humane treatment, you have to have informed consent. And since there has been so much back and forth about what is in the vaccine, what isn't in the vaccine, have they shown us all the papers from Pfizer, Moderna, J&J, AstraZeneca? Have they disclosed all of this? There is too much mystery for me to feel that I am confident in complete disclosure. I would like them to have a team discussing the side effects that are being discussed so much and the death rate. So I feel it's important to have open disclosure, and I would like to have that. And I would like it to be understood that these are still experimental. These are emergency use authorizations. So given all that, I can't recommend them because I don't feel comfortable about informed consent. I don't feel qualified that I can give that recommendation. So the Delta variant, my thought on that is I'd like to see it analyzed, cultured. I don't think it exists. I'm not even sure there's any culture for the original. I think they're all working off of a computer algorithm of the design of the SARS-CoV-2. But the natural immunity, I'm happy to tell you, Nature has just put out a new article about the antibodies, and many scientists are saying natural immunity appears to be durable and adequate and actually have more capacity because the entire virus is involved, and your antibodies can make a more holistic approach with T cell memory and B cell memory components that will live on for decades in your bone marrow and in some of your lymph nodes, germinating sites for B cell memory. So that's all very good news. So I don't know that I would worry about it. Take good care of yourself, and if you feel ill, you should quarantine yourself and stay home like you would any year before, the decades before you would stay home if you were not well. And be cautious about hugging and kissing if you feel that you're sick. Outside of that, I think we should feel very confident in the immune system and our healthy diets and our nutrients that enhance our own immune system as well. Jason said, what should I do if I have bile acid malabsorption? Possible self-diagnosis. Well, you mean you're implying that your gallbladder duct is blocked and you cannot secrete your bile? Is that what you're saying? I don't think that's what you're saying. Your liver takes waste products from your red blood cells and through a whole process turns this into bile. That bile is then sequestered into the gallbladder, and that is then excreted when you eat fat so that it emulsifies the fat to help with healthy absorption. That's the way it's supposed to go. The older you get, the less easy it is to digest your foods, the less easy it is for all your muscles and contraction, even your stomach to empty. And so we all can tend to have backup. Hence, drink enough water, have a exercise routine all the time, have a cutoff time where you will stop eating every day. I recommend that be around 6 o'clock in the evening. Take digestive enzymes, and the orthodigestine that we have has ox bile in it, so that helps emulsify your fats in your diet for you. That would be a beginning point for you, I would say, Jason. Then I would get a complete digestive stool analysis from Doctor's Data. They do the bile assay in your stool. Now, if your stool is brown, tan, brown, dark in color, then you know the bile is coming out, because that's what gives your bowel movements the brownish color of it. That's bile in it. So as long as your bowel movements are not like white chalk, then you know indeed that you are secreting your bile. So complete digestive stool analysis to look at that, the type of bacteria, the digestion of fats and vegetable fibers, the fatty acid composition, inflammatory markers. I mean, it's a complete digestive stool analysis I would do. Check the color of your stool, use orthodigestine whenever you eat your foods, and see a functional doctor and discuss that with them. Okay, Deborah, let's see. Hi, Dr. Rita. Hi, Deborah. Everybody, Deborah is my sister. So this is like a family visit. So Deborah, hi, how are you? Hi, what is osteoarthritis, and how can an individual get relief in a hip or other joints? Well, osteo means bone, arth means joint, and itis means inflammation. So the bone at the joint is inflamed. That's all that's saying. And we dry out with aging. So I would say the number one thing is drink plenty of water. Half your weight in pounds as ounces every day. So you have to drink your water. Joints, and I have on my YouTube, Tustin Longevity Center YouTube, if you scroll down to last year, you'll see my whole lecture, and I point out the tiny, tiny blood supply to the articulating joints, and you only have a synovial membrane with a teeny weeny teensy little capillary arteriole. That's extremely important. It's the only way you're going to diffuse nutrients into the joint and absorb waste material from the chondrocytes and the cartilage, as well as have enough healthy fluid in there. Then you have to live an anti-inflammatory lifestyle. You have to do all the things that all health requires. So whether it's talking about joints or heart disease or Alzheimer's or rash or inflammatory bowel disease, all these things have to be addressed as water in your diet, a low carb diet, maybe go carnivore so you're not eating all those food lectins. Food lectins are often associated with joint pains because of the aging and hole perforation, the leakiness of your gastrointestinal tube. Then enzymes. We lose enzymes with age that helps disinflame us. And then since all of our membranes are made of fat and protein, all your cells are made of fat and protein. And so you have to eat enough fat and protein in your diet every day. And then you have to digest it. So you might need, as you age, orthodigestive enzymes. And then take the systemic enzymes like Vitalzyme or Proteozyme or Vascuzyme for the anti-inflammatories. Then there are things like taking chondroitin sulfate, glucosamine sulfate, and the other things would be magnesium for muscle relaxation, walking. Then you could do EDTA chelation therapy that helps all those capillaries and the little synovium arterioles of your joints to improve the circulation there. Turmeric, natural anti-inflammatory, curcumin could be helpful as well. So those are the things I would do, Deborah. And a last thing would be hormones. hormones help us with our rejuvenation of our membranes, skin thickness, your elastin collagen, wrinkling, sagging. Hormones are a part of helping your collagen elastin formation. So if you're taking natural hormone replacement under the monitor of a physician who is familiar with monitoring it, healthy ranges, doing your pelvic, doing your male hormone prostate checks, blood counts if you're on testosterone, because that can make your red blood cell go up. I mean, hormones have wonderful benefits, but you do have to monitor certain things if you're giving them to yourself exogenously. But hormones are helpful with arthritis. In fact, many times, I think when I give natural hormone replacement, patients will say, I'm less stiff, my hips are less stiff, and so forth. And me at almost 70, I have absolutely no joint pain whatsoever. So I think all those things are involved, Deborah. Jennifer, and she says, hi, Dr. Rita. Hi, back to you, Jennifer. You mentioned intermittent fasting. Should we change the hours we eat based on the time of year? For instance, when the sun goes down earlier. I would say if it's dark, you shouldn't be eating because there's a connection with the electromagnetic energy of the sun talking to our pineal gland, which is going to be releasing somatostatin growth factors that will work on healing us, and it is linked to the time of the year seasonally. So that the winter time is a poorer time to eat late, and I agree 100% with that. When I was a flight surgeon and I was taking care of pilots in the military, both Air Force, Navy pilots, Army pilots, and Marine pilots, we would be amazed at the circadian rhythm and the problem they had with eating and flying, because I needed them to be sharp, especially if they were fighter jet pilots. So you have to understand they self-learned. All these pilots would just self-report to me that they would not eat maybe for a day after they landed to have their performance superior. And so I have seen it in life, in performance, that the time of the year and the time of the day when that sun is out is going to impact your body's healing. And if you eat late at night, you are going to clog up your system and you're going to stop the growth hormone secretion and you'll age quicker. Damien says, I love your comforting words, Dr. Ellithorpe. Thank you. Yes, we Christians are happy and at peace with our Lord. Well, amen. Amen. It is good to have a faith, and it is good to have a understanding of who you are and why you're on the planet, and that every life matters. In my particular faith, my God died for everyone. So it isn't a religion, it isn't a people or a place. It is all humanity, all life is sacred. And so that's why I have to treat everyone I see with the utmost respect, regardless of whether they have faith or not. But I encourage them for medical research reasons that it's good to have the socialization and group and comfort of a faith-based lifestyle. And but I'm just very much in favor of my God who died for everyone and forgave everyone. It's so very comforting to know he remembers my sins no more, and they're as far away as the east is from the west. So I've done a lot wrong, folks, that I should go to hell for it, And I'm just very thankful that he forgave me. So thank you, Damien. I can't help but praise him because he's on my mind all the time. Every time I think of helping my patients, answering questions, I think of how magnificent all of you are, how valuable all of you are. And many of you here I know personally. And even though I have to speak in generalities, but I have a blast at work. It's so interesting to know your lifestyles, what you've done in the past, stories over the decades roll by. It truly is like you're my family, and I love doing research. Look at, look at all this. This is one article. This is just one article here. Better Pathology, Better Pathology Archives. And so I'm going to read this pathologist's work. And why am I going to eke and creak through this? It's because I love what I do, and I love my patients, and I want to be there to have some good answers. Let's see. Deborah, thank you, sister. Yes, I thank you. And Deborah says hi to Damien. And EH, hi, doctor. What kind of zinc supplement is the best? It's an amino acid chelate. And we have Zinlori is a zinc carnosine. So that helps with weight loss as well as an antacid in the stomach, and tends to fight H. pylori. So that's one of the natural things that is so very good for stomach upsets. And that's zinc carnosine, called Zinlori, Zinlorei, something like that. And then I don't know which type of zinc we have. Let me see here if I have the zinc showing up. I don't think I have it right here, but it has to have an amino acid chelate to it, EH. Any kind of malate, citrate, glycinate, sulfate, those would be the kinds that would be beneficial. Let's see, how much zinc is protective against COVID-19? Well, all viruses. It acts as a means of inhibiting viral replication intracellularly. And so quercetin is a natural herbal substance that you can take. I take every day, about 500 milligrams. Quercetin acts like hydroxychloroquine. It acts like ivermectin naturally. Quercetin is a ionophore that helps transport zinc intracellularly. Zinc then inhibits the ribosomal copies of the viral particles. How many milligrams? I would say I've been taking 6 milligrams in my TLC Energy Core for decades, so I'm not taking additional zinc. But if you're concerned or you haven't been faithful, then I would take somewhere in the realm of 25 milligrams to 50 milligrams of zinc a day. And I would do that as long as you're concerned. And then consider seeing a holistic practitioner, functional medicine, integrative doctor, alternative medicine, whatever you want to call us, medical doctor, osteopathic doctor, naturopathic doctor, who has the licensure to check your minerals, blood labs, and look at your mineral status as well. Now, I had at the very end, I just see here, I don't want to forget some questions that were emailed in to me. And one says, Lisa asks that I've recently heard pine needle tea is a possible antidote for spike protein transmissions. Yes, I've heard that too. That's some kind of a sialic acid that's in white pine needle tea. But I don't think you need to worry about this, Lisa, because we know good old-fashioned quercetin in DHIS, good old zinc, the systemic enzymes that you take on an empty stomach, EDTA chelation therapy. I've seen some writings that the charge particle of the spike protein is a positive or a cation, and EDTA is an anion, like all amino acids are negatively charged. It grabs onto, attracts the positive heavy metals are all cations, and so is the spike protein apparently. So chelation is probably a very smart thing to do. So I'm not sure that you need to worry about pine needle tea. But yes, I have read some articles on that. Of course, there have been no clinical studies done on this. This is all anecdotal information. But yes, I've heard that as well. And is there a website or a study that details the effectiveness, ineffectiveness of wearing a mask to protect from COVID vaccine? Well, if you Google Finland and the mask, you'll see in Finland they did a huge study with people wearing the mask and those not wearing it. And they found that those who wore the mask had far less incidence of positivity on COVID testing than those who wore the mask. Then there was another study done in Germany just recently. We're talking, I think, in June or May in Germany. This was done recently in 21. The Finland study was done in 20. The Germany study said that they found that the masks were retaining too much carbon dioxide in the children that were at EPA, Environmental Protection Agency, OSHA, Occupational Health and Safety standards, warning levels, even after 3 minutes of using them. That's 3 minutes. Then there's an Oxford study done for the CDC that was quoted before the COVID-19 viral illness, before SARS-CoV-2. This Oxford study in 2017 was on SARS, but not SARS-CoV-2, and viral illnesses and the value of masks. And of course, they said they were not found to be meaningfully protective in any measure that they looked at. So you will find articles, and you have to watch how you're reading it, where it'll talk about the spittle. So if you're talking and spitting, these moisture particles, mists, are inhibited. But of course, if you're ill, you should stay home. If you're coughing, you know you're ill, stay home. But spittle, so be careful if you're seeing an article that claims to be protective. It may be for just addressing spit, okay, versus the particle size of the viron is like 0.1 nanoparticles or something like that. It's so tiny. If you put on these masks and you smoke, you can see people smoking, and the smoke just passes through the mask, and smoke particles are about 0.7 microns, and the viron particles themselves are like 0.1 or very much smaller than even smoke. So look up the Finnish study, look up the German study on CO2, look up the Oxford study of 2017 before the SARS-CoV-2, where they're actually talking about SARS, the common coronal viruses, influenza viruses, and masking. And I've grown up 40 years practicing medicine. I've just never, ever, ever seen the healthy required to mask or quarantine themselves. You can't transmit something if you're not ill. Okay. And then the second thing was, I had another gentleman, son, Edwidge, okay, and he said there's some child, little 3-year-old, who had kidney cancer and nephroblastoma, and in January had surgery, and they got the tumor taken out, but there was big clotting. And now the little child suffers from leakage of chylous ascites. That's where the lymph is just leaking lymph material into the stomach, so it looks like skim milk, you might say, coming out, and then it gets a big belly, and they have to drain it off. And he's asking if I know anything. Well, chyle is this chylous material, chylous, ascites, is associated with nephrotic syndrome, kidney disease, and post-surgical issues like this. Usually there might be some trauma to the lymph system, and very often, if it isn't surgically corrected, corrects itself over time. But chyle is full of triglycerides, and that's what gives it its fat. Like if you take black coffee, if you have a glass of black coffee and you put a pat of butter in it, and then you stir it up or mix it, it looks like cream is in there. That's because all the fat is dispersed. So when the drippings of the chyme from the lymph is full of this fat, so a very low carbohydrate diet would be very beneficial, probably in this child. I'm not an expert at all in nephroblastoma. I'm not an oncologist or a surgeon. So I would encourage you to look at all the research on chylous material. The liquid itself is a high triglyceride liquid, and those triglycerides come from fat. And it would be healthier for the child to be on find out the blood type, ABO. A's don't digest fats very well, therefore they have a craving for all the carbs that make this chylous liquid even higher. So that would be a starting point. And hopefully this little dear child is in France. So it'd be interesting, Edwidge, if you would let me know her blood type, tell them to find out if she's a blood type A. Then she would need digestive enzymes, which could help take the stress off this lymph, and lots of water and a low carb diet. That would probably be very helpful. But she's in France and she has her doctors, but those might be some helpful areas to talk about. So I'm going to end. Wow, we've really gone over today. You got me all excited, everyone. So again, thank you for subscribing. Thank you for liking. And thank you for putting a comment at the bottom of these. I appreciate if you do that, and that will continue to help us and help your friends share this. And I say with that, a good night and God bless to everyone. Take care.